Welcome to 5-Minute Fertility, where you can learn fertility facts in less than 5 minutes. I'm Dr. Stephen Sawin from South Jersey Fertility Center, and today we're going to be discussing donor insemination. Donor sperm can be utilized for many indications. For example, single women or women in a same-sex relationship where a male partner is not available can order donor sperm to achieve a pregnancy. Women who do have a sexually intimate male partner utilize donor sperm often because he has no sperm, a condition called azoospermia, or may harbor a genetic disease which the couple wishes not to be transmitted to their child. Men who have had a vasectomy and choose not to have it reversed sometimes also utilize donor sperm. There are various donor sperm banks available that have been in business for many years and are rigorously regulated by the government. Selection of a donor sperm is done by registering with these sperm banks online and visualizing their list of donors. The donors are anonymous. However, much information is given about the donor, including obvious things such as race, genetic diseases, medical conditions, and characteristics such as eye color, hair color, and so forth. Additional information can be obtained from the sperm bank, sometimes at extra cost, such as baby pictures or information about why the donor is choosing to be a donor. Also, the donors have to go infectious disease screening for HIV, hepatitis, syphilis, and the like, and the sperm is quarantined, frozen for 6 months before it is released when the donor has been retested for these infectious diseases. They also undergo genetic testing and give up paternity rights, and the whole process is anonymous. We also have our recipients undergo infectious disease screening and offer psychological counseling because it is a different way of having a family, all for the protection of the patient. The donor sperm is ordered directly from the sperm bank, and the samples are shipped in liquid nitrogen tanks to our office, where we transfer them to our tanks until they are ready to be used. There is certainly a cost for shipping the sperm and for the sperm itself, which is sometimes not covered by insurance, and information is on the donor sperm websites as to the cost of the specimen. We also recommend that specimens be ordered that are washed ahead of time prior to freezing, because the best treatment for donor insemination is to take a sample and do an intrauterine insemination, where the sperm is placed into the uterine cavity at the time of ovulation. This can be done by timing in a natural cycle with ovulation predictor kits, or more successfully to use ovulation induction medications to track a follicle and trigger the release of the follicle at a specific time to thaw the sperm sample and place it into the uterus with high success rates. If you would like to learn more about donor insemination, please call South Jersey Fertility Center, and thank you for listening to 5-Minute Fertility.